Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. So lots to talk about today. It is very late right now. I have been out running around doing errands, and you know how it is. Like the week before you gotta go anywhere, there's like a ton of things to do. So that's pretty much what happened today. And we got a nice little rainstorm in the middle of it all. So thankfully I did not melt. Anyway, I got a lot of good questions today for Q&A Tuesday. So I'm going to be going over those in a minute, but I wanted to share the good news. So, if you've been following my channel, I've talked about the fact that I do classes with my providers, and it is part of my evaluation. Every year we get evaluated, and this is one of the bullets that we have on our evaluation is doing live presentations with our providers. Well, this is the part of the evaluation that I love, okay? Because this is the part that I just, you know, this is my playground. I love to do presentations, especially with, providers and engaging with them and everything. I love it. That is my favorite part. So, but before I get to do these presentations, I have to have my slides approved by my supervisor, and she has to make her final corrections, and if she sees anything wrong, she's got to let me know, or if there's, something that she doesn't like, then I need to update it before she'll do the final sign off on it. Well, the last time I had submitted a slideshow, she was getting me for like a font size. She didn't like the font size, and I said, can you just approve this, because is the information sound? That's all he needs to know. Is there information sound? And it was just a lot of back and forth, and I don't like going back and forth because I like for things to be very efficient. I like to work efficiently. I don't like a lot of muss and fuss. I can do an effective presentation. I don't like the back and forth on little things. And but that was one thing that we kept going around in circles about before. And so I said, okay, I'm going to make sure that this set of slides is going to be meticulously done so that we don't have this back and forth. And my class, the next one coming up is in October with the PA students again. And they wanted it about modifiers and global days. And so I said, sure, no problem, that I would do that for them. So I wrote a very nice slide deck, okay? And I had submitted it 2 weeks ago, okay? On the, actually, no, it wasn't 2 weeks ago. It was more than that, because I submitted it on the 20th of August is when I submitted it, and for approval. And I hadn't heard back from her. And, well, of course, I'm going to Chicago, and then by the time I get back, you know what I mean, I have that 1 week, and then by the time it's going to be October, and I'm going to have to do the class, and I don't like rushing at the last minute. So I submitted her another email today, and I forwarded to her, and I asked her, I'm just catching up with you. I want to know if there's been any progress. I need to find out what the status is of these slides so that I can go ahead and do the final prep for these. I'm not going to be here the following week. I'm going to be off on Friday. I need to know what's going on. So she says, oh, yes. And she said, these are very concise. And she said, I like them. There's just a couple of grammatical errors. And I'm like, whatever. She just wanted me to put utilize. She just wanted me to throw in the word utilize in the slides. And I'm like, whatever, fine. And then I forgot to put the word to, in there. And I'm like, okay, whatever. You know what I mean? If that is all you have, I'm fine with that. And I wrote her back, and I was like, hallelujah. So I did all the corrections, and I sent it to her, and I said, is this approved? Can I go ahead and print this? Can I go ahead and ready this? And she wrote me back, and she said, yes, everything's approved. So I said, okay, fine. So I got everything done. So my class is already prepped and ready for October, and I'm very excited about that because I don't like waiting at the last minute to do things. So that was a big part of my day today. I was very excited about it, and but that's one of the things that you have to do as a medical coder. Somebody was asking me that they didn't think that they could do just coding. That it seemed like it was monotonous. They're still a student, and they were saying that it just seems like it's sort of monotonous all day. And I explained that it's not just coding that medical coders do. It is not just that, okay? Our days are spent, or typically, for me, what a typical day looks like for me, okay? Because I work in a facility. I don't work remotely. But I work in a facility, and I'm interacting with my providers. I am going to coder meetings, which if you've watched my channel, those are not my most favorite things to do. I like meetings with providers. It's other coders in the meetings, like when we have to do like these education things, it just seems sort of long. And it's just like that's where I get tripped up. Um, those are the ones that I'm talking about. So like I have coder meetings, we have other education that we have to do to make sure that we maintain, our status for using the computers and things like that and the systems. There's a lot of things to do other than just coding, or if you're having to work on error reports. Sometimes the systems will mess up occasionally, and maybe you've transmitted it and then it won't cross over. So then you have to go back and correct errors. So those are also things that medical coders have to do. It is literally not just you're going to be sitting in front of a computer and working all day like that. No, that it is a lot more. There's so much more to being a medical coder than just coding the records. So it all goes into where are you working, what are you doing, what is your function, that is a big part of it. So again, it depends on where you're working and what you are assigned to do. But if you are a coder, if you're a medical coder, these are some of the things that you have to do, and it's just part of the job. I like I like going to work. That saying, if you love what you do, you never work a day in your life. I'm there. I'm literally there at that point. Because I go to work, and I go to my office, and I set up, and I do all of these things, and I get ready to start the day, and I leave my door open, and I have people walking by saying hello, good morning, whatever, or they see me working, and they leave me alone. And or I have somebody stop by and say, hey, I have a question, and I answer their question, and I help them, and they say thank you, and that kind of thing. And I enjoy it. I mean, like I said, there's some days that I don't even want to go home, because I'm having like I literally get into it so much that I don't want to leave. Because it's like you just get so wrapped up in these records, and then by the time you know it, it's the end of the day. And I really like what I do. I enjoy what I do. This is it's fun for me. Some people may not enjoy reading all day. I do. I love reading all day. I'm like a long-tailed cat in a room full of rocking chairs. It is fun for me. I mean, that's what I do. But yeah, if you it's not monotonous. And then if you are working with different clinics, it really doesn't get monotonous, because you have to stay on your A game. I work between 5 different clinics. I have 21 different providers. That's 21 different personalities I got to deal with. And it's 21 different ways of documenting, and I've got to learn each and every one of them. And I know each and every one of them. I can tell you down to the letter who does what, without even, if they didn't sign their notes, and I could just look at their note and see, oh yeah, I know whose documentation that is, I know whose documentation that is, I know whose documentation that is. That's how well I know my providers. The more you know your providers, the better you know them, the better off you'll be, because you can anticipate like what their learning needs are. Like if there's going to be something that's new that's coming out, and that they want you to be more hands-on with them, then that's what you got to do, is be hands-on with them. If they like only email, then you only email them, it's all about the details. All right, so let's go ahead and get started with the questions. Number one, what are the possible causes of claim denials? So there's many many reasons why a claim would be denied, okay? But from a medical coding standpoint, okay, either the documentation is not there, the incorrect procedure code was selected, the incorrect diagnosis code was selected, the diagnosis codes and the procedure codes don't go together, if that makes sense. Like, if you had selected tobacco cessation, okay, and you said that the patient had alcohol abuse, okay, didn't mention anything about tobacco cessation or tobacco use, obviously that could lead to a denial, because the use of this code for tobacco cessation counseling is not supported by the documentation, because all they had listed was alcohol abuse. So that is something where it's not matching. If you said that the patient had a wrist fracture and then you selected an ankle reduction, you know what I mean? That's another something that's like, okay, that procedure does not match that diagnosis code. It's all about the documentation. Like I said before, if you are looking at this documentation and it is either not complete or if something is not clear, like in the outpatient setting, we can't code anything that's ambiguous, nothing that is unsure, probable, suspected, likely, maybe, those words that we all hate as outpatient coders. Those are the things that maybe could possibly be the reason something gets denied. Of course, there's also reasons with the insurance company itself, but what are some of the ways that, what are some of the steps that can be taken to rectify the situation? Working with your providers to make sure that they're documenting everything fully. If they are not being as specific, like with measurements, like if they're doing laceration repair, and they don't talk about the fact that they're going through different layers, you know what I mean? That could also be an issue. It's all about making sure that documentation matches up with what they're reporting. Because if you don't, then you're going to see a problem there. So it's all about paying attention to those details. One of the ways to rectify those situations and make sure that they don't happen often is to be as engaged with your providers as you possibly can. I will constantly say this because I've seen a lot of coders not want to talk to their providers, and I've seen the reasons why some coders do not want to talk to their providers, because they get yelled at. I had a situation a couple of weeks ago where I did get yelled at, by two providers that I love. I love these guys, but they were just in a mood. For some reason that day, they both decided they were not going to do what I asked them to do. And it was very simple. It's very simple, straightforward stuff. And I thought they were already doing it, and they weren't. And so it's just like, oh, okay, well, hey, you guys, you should be doing this. Why are you not doing this? And it was just like, no, I'm not doing it. I'm not doing it. And they were very steadfast, and no, they're not doing it. It's like, oh, okay. So, like I said, it did hurt my feelings, because it was just like, oh, okay, well, you won't listen to me. Like, really? I barely ask you to do anything because you guys are doing really good. So when I do ask you to do something, you can't do it. Okay. But we've worked it out. We're all okay now. Everything's good. But it's one of those things. And somebody else in my same shoes would have said, I'm not dealing with those guys anymore. You know what I mean? Because they've had that. They've had coders who before they've yelled at, and the coders were just like, okay, fine. Then you do whatever you want then. And they never tried to work with them again. But for me, you know how they say that, you got to be patient, and I am for all my impatience. I am patient. Okay, there are people that I do give extra patience to, because it's important to me. It's important to me that they get out, all the energy that they need to get out, and then they can come back to, okay, let's go back on this right path. Because sometimes I think they have to sort of say, no, I'm not doing it, just so they could say they said no, they're not doing it. So at least that's what one provider told me. He's like, I can't just do what you tell me to do right away. And I was like, it's your show, sir. Go ahead. And then he comes back later on. He's like, did you see I did what you told me to do? I said, yes. So that's one of the things that it could possibly be as well. So you just have to roll with it. And I rolled with it. I mean, I went through that little bump with them and everything. Like I said, now everything's good. We're back to normal again. So, but it's just going through those things, So sometimes if you encounter a little bit of pushback, you just have to sort of ride that ride with them, just let them go through it, because eventually, if you treat them right and they know that you're patient with them, they'll come back to you and they'll work with you, but you just sort of have to let them go with it, So that's my suggestion on that one. Tips on sequencing. All right. So, I did a video and I'm going to do another one. Okay. So, I'm going to do another one about urology tomorrow. So, tips on sequencing. And these ones that I'm talking about for tomorrow as well, these can be applied to basically any specialty. First, look at the reason that the patient is coming in. Why are they there? Okay, are they there for a follow-up? Are they there for an injury? What are they there for? Are they there because they have appendicitis? Okay, let's just say, okay, appendicitis is a good example. Let's just go with that one, okay? Give you guys a break from the injuries. All right. So the patient comes in and they have stomach pain. It just hurts all over, and they have nausea and vomiting and things like that, and they're just there. They're there for a visit, and they're like, I've had all this nausea and vomiting for 5 days, and my stomach really hurts, and I just don't know what to do anymore. It started off slow, and now it's just getting worse. And but this has been going on for about a week, and which I think it'll probably be less than that, but let's just go with it, okay? And so the doctor goes through and does their whole examination and everything. They do their radiology, they do all their tests, and then finds out that the patient has appendicitis. So in their assessment and plan, they say the patient arrived with abdominal pain, nausea, vomiting, and their diagnosis now is acute appendicitis. We are going to treat this patient with a surgery on tomorrow. Yes, they came in with abdominal pain, nausea, and vomiting, but you're not going to pick those up in the outpatient setting. You're not going to pick those up because why? We have a definitive diagnosis, which is that acute appendicitis. So if you look up the symptoms for acute appendicitis, you're going to find these, okay? Abdominal pain, nausea, vomiting, these are all parts of acute appendicitis. So you would not pick up those. You would get those off the table. You would pick up that acute appendicitis because that is all of these symptoms in a nutshell. Okay, we have a definitive diagnosis with that acute appendicitis. So now the provider has to make the decision for surgery and all this and all that. So depending on their documentation, they're going to get an evaluation and management level out of it. And then, later on they'll do the surgery or whatever. But that's just to sort of give you an idea in that situation. Same thing if the patient came in and they said that their elbow hurts, okay? Their left elbow hurts. Well, what happened? Well, they were playing tennis and they swung the racket, and it just felt like it popped out of place or whatever. So they're coming in with elbow pain, but because they had, done the tennis racket, they had put force behind it. They do the radiology. The doctor does their workup, and the doctor finds out that it is dislocated. Okay, let's just go with dislocation. Their elbow's dislocated. So they say, okay, well, you have a dislocated elbow. Well, naturally, they came in with elbow pain. Okay, you're not gonna pick up the elbow pain. Why? Because something happened. They were doing something, right? They were playing tennis, and it come to find out that it's dislocated. So it was overexertion. They were injured. That is an injury. So that's what you're gonna pick up. Is that dislocation of the elbow? You're not gonna pick up elbow pain because it's not an organic condition. The patient was doing something. They were swinging a racket, and that was what caused them to have that elbow pain. Okay, because we find out that it is a dislocation. So there you go. These are just some things I'm thinking off the top of my head. Those are some of the examples, that you could think of when you're doing sequencing. Again, if the patient has chronic conditions, let's say the same dislocated elbow, right? They came in with a dislocated elbow, but they also have diabetes and hypertension. Okay, now, what are we going to do then? Okay, obviously the diabetes and hypertension is not the reason that the patient came in. Okay, they came in because they have a dislocated elbow, or came in because they had elbow pain, but we find out that it's because of the dislocation. So which one is going to go first? The diabetes and hypertension, or the elbow? The elbow, because that's the reason that the patient came in for the visit, was so that the provider could look at the elbow. And that's how you decide. Always think about what is bringing the patient in first. That's how you decide how you can sequence. This was an issue I had in the beginning of myself, because I was just like, how do you know? I will be working on more episodes probably after I get back from Chicago about sequencing, and I'll probably do a whole week-long series about sequencing because I think it's important to show situations where the appendicitis and things like that, and also show where they have chronic conditions and how to understand which chronic condition is going to go first, or which additional conditions are going to go first. You want to rank them by severity. You know what I mean? Obviously heart disease is going to outrank diabetes, because that's your heart. Your heart's going to come first, and then diabetes. They're both equally serious conditions, yes. But that's one thing that you can look at. Obviously if they have some other serious condition, maybe what is that one I was thinking of? Hyperlipidemia. Those are things that obviously could be controlled with medication as well. So diabetes would outrank hyperlipidemia. Okay, because obviously they can die if their diabetes is not controlled, right? If they don't have their medication, they can die from it. I mean, hyperlipidemia is very serious as well, but diabetes is much more pressing, I would think, between the two. Okay, and if you're really not sure about which diagnosis would outrank which one, this is when knowing your disease processes is going to come in handy. So which leads me to my next question is, what should I study if I'm going to be a medical coder? The first and foremost, get you an anatomy book. Get an anatomy book and a pathophysiology book. Start understanding the body. Okay, because this is 100% of what you're going to be working with. You got to understand the disease process. You got to understand the body, the mechanics of the body, and everything. You've got to get that down, or you've got to get a good general understanding of it. Okay, and then your next bit of study should be medical terminology, because if you don't understand the word that you're looking at, this could be an issue, you know? So make sure that you are looking at those things, and that's going to give you some good foundational knowledge right there. I keep wanting to sneeze. I'm telling y'all. Oh my gosh. I can't wait till this nasally stuff passes. uh, uh okay. Yes. What else do we got here? Is there any math involved in medical coding? I keep getting that question. I think maybe some people are thinking that like medical coding is like the coding that they do on computers, and the coding that they do on computers, I know that involves math, but medical coding, it involves reading comprehension. There is no math. There is no math in medical coding. Okay, so just it's that math is only involved with computer coding, not with medical coding. Okay. What should I do if I get stuck on a record? Okay. If you get stuck on a record and you need to just sort of put it on pause and just sort of move on to the next record so that you can give your brain time to wrap your head around it, or sometimes if it's too early in the morning. I used to have this issue when I did some level 1 traumas. It's not the easiest thing to do first thing in the morning, so you want to just sort of put pause on that. Not all records are going to be so quick to get through, okay? Some records are going to take a little bit more time, and there are going to be times when you're going to have a record that has 30 different diagnoses. I think that's my personal best, is 30 different diagnoses for one patient. So, I mean, I would rather take my time and get it right rather than try to just fly through, get it wrong, and then all of a sudden there's a big mess, okay? Particularly when they have something as serious as a level 1 trauma, or maybe they are chronically ill and they've got lots of illnesses. You really want to make sure that you are coding it correctly and making sure that you're sequencing it right as well, and making sure that you're getting everything that the provider and the patient everything that happened in their visit. So you want to make sure that you're taking your time on those. That's not going to happen like all the time, hopefully not. You can have one that's going to be that involved. But if you do have one that's that involved, let your supervisor know. Let them know, hey man, I had maybe don't say man, but I had one that was this really bad one. It's got like all these diagnoses and it's very complex. And, let them know, so this way they don't think that you're goofing off, I've had some records where I had to talk to my boss. I'm like, look, this one literally took me an hour. I've had one record done in an hour because it took me this, and then I had to look at this and this and this and this. And she was like, oh, okay, But then you sort of make it up later, with some of your easier charts. That's something to think about when you are working with really complex charts. Make sure that you make a note and let your supervisor know, hey, this one was a really complex chart. So that way they don't think that you're sort of just messing around and not doing anything. Don't take advantage of that, though. Don't make everything, oh, this was hard, because you don't feel like working that day. Just if you're having an issue, because there it goes, and I'm going to stop talking here in a minute. If you're having an issue with a chart that's getting really complex, just take a break from it and then just come back to it. because there's nothing worse than getting stuck on a record and then just sort of spinning your wheels, because you're not doing yourself or anyone else any favors. Okay, so just make sure that you take your time, and the speed will get there. You'll get speed after a while. But when you are coding complex charts, make sure that you're getting everything, and make sure that you're paying attention to what diagnosis you're picking up as well. Because keep in mind, these are people's medical records, okay? And everything that you pick up, it follows them as well. So that's something to keep in mind. And what you're picking up can also impact their insurance, you know. So that's another thing too that you got to think about. So just some thoughts from me to you. And my voice is about to give out. So I'm going to go ahead and wrap this one up tonight. But I guess I will be back tomorrow, okay? I'll be shooting the video about urology tomorrow. We're going to do urology sequencing tomorrow. So exciting stuff. All right. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right. I will see y'all on the next video. Bye.